A lot of our patients, love seeing students and, interacting with them. Patients with mood disorders, patients with psychotic disorder, potential comorbid substance use. Psychiatry is no longer like a backup specialty. Experience here definitely add to the strengths of the application.
Good morning, good afternoon, everyone. We have a special guest, Dr. Abdel, and his team helps a lot of our students in psychiatry rotation. So welcome, Dr. Abdel. I'm very happy and glad that you could make it today.
Thank you very much. My pleasure.
So, Dr. Abdel, when it comes to psychiatry rotation, so psychiatry, as you know, has become very, very competitive nowadays. IMGs are finding it very difficult. So help our students understand a day in the life of their rotations with you. What do they end up doing?
So they come in the morning, we discuss potential cases, potential topics, and then after that they start shadowing the patients. This is a little bit of a hands-on experience. A lot of our patients, love seeing students and, interacting with them. If they want, they can, attend the interview with the patients, discuss medication regimens with us. And then we usually, sometimes in the afternoon, we might have some hospital cases or telehealth cases. If it's allowed, they may attend with us.
Okay. And psychiatry specific, what is the patient pathology? What type of, are we talking addiction patients, or what are we talking? What do the students, what type of patients do they see?
So we're lucky here because we almost see everything. We see patients with mood disorders, patients with psychotic disorder, potential comorbid substance use, also dementia. We're very well known in the area that we're an important site for patients with neurocognitive disorders as well.
Yeah. And what is a psychiatry program director looking for when he or she looks at a student CV who has rotated with you? What are they trying to assess from a student?
That's a very good question. As you said, psychiatry is becoming very competitive, so they are looking for authentic experiences. Psychiatry is no longer like a backup specialty, so they want to see, the depth of the psychiatric experience in the CV. They want to see the letters of recommendation. One good thing here, in addition to offering the rotation, we're actually a well-known site for preparing psychiatrists for the board exam. So we have a site called My Psych Board. They train actually psychiatrists in, board exam and multiple choice questions. So having that experience here definitely add to the strengths of the application.
So what are the logistics? How will an IMG manage? Is it, Uber, or is it, do they get some housing nearby? How do these IMGs navigate the city?
That's a very good question. So I think, thank God, we're still in the Midwest. The cost is not, very high. So if they stay in one of these local extended stay, for example, hotels, we have a lot of people who stay there. They sometimes take the bus. Some of them, get an Uber or even rent a car. But if they're, close to us, sometimes even they walk. There are some extended stay, hotels, or some of them got an Airbnb, and it's a walkable community.
All right. Thank you very much, sir. I appreciate, and hopefully students find it useful as well.
Thank you.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.